I'm Giuseppe Rosano. I'm consultant cardiologist and professor of cardiology at St George's Hospital in London, and I'm president-elect of the Heart Failure Association. First of all, the HFA Congress has been a very great success. We had more than 6,000 participants, more than 50% in presence. So that was a very good attendance, which is a very good news given that we are coming after 2 years of lockdown. We've been preceded by the press release of another positive trial in heart failure, which was the DELIVER trial with dapagliflozin that has built up on the evidence that we have with the SGLT2 inhibitors. Now we have 2 trials that are clearly positive, one with empagliflozin, the other one with dapagliflozin, and therefore we look forward to a class 1 a recommendation for these drugs in heart failure with preserved ejection fraction. Then during the Congress we've had many other trials and many other studies, but what has been coming up is the need to explain how to implement guidelines in clinical practice. We had the guidelines released in 2021 and didn't have time to clearly understand how to implement them. Now we know that we have to profile patients. We need to know, we know that we need to phenotype them and treat according to phenotypes. And also we need to intercept when they worsen. And so another big area is the definition of worsening heart failure, for which we have drugs like vericiguat that has been shown to be very effective, but also another drug that is not yet on the market, which is omecamtiv mecarbil. But also with in acute patients or patients who are ready to be discharged, we also have the evidence of the efficacy of the IV iron. So it's a bright area for heart failure. So a lot coming from patients who are ready to be discharged, so for therapies that have to be started immediately before discharge or immediately after discharge, but also give confidence to the clinicians on how to implement guidelines using patient phenotyping.